This is fabulous. I love it. I'm trying to understand how it works. So from a physician perspective, so is Medyo like that patients can access physicians that are already part of this group, or can so let's say that a physician and a patient are looking for a platform in order to be able to communicate in a secure way, we can both just find, with your website, we sort of predetermine we'll meet by Medyo at this time on that day, and we don't just go on and log on?
It's the limit is your imagination. So the way that I do it currently, because I have an office-based practice, I'm in the office, but I'm available by email and message. So my patients, what works for them is they will send me an email or a message saying, this is what's happening. What time are you available to meet today? And I might have a cancellation. I might have a block of time during my day, or I might say, I'm going to be home and free at 8 o'clock tonight. Are you free to meet up then? And then we arrange it. There are other people who will book off a period of time and say, you know what, I'm going to be available between 2 and 4 today, so I'm going to let all my patients know that they can come and log in at any time. And the patients love it because if for whatever reason I'm held up, instead of waiting there in a physical waiting room where they're exposed to all the wonderful things that are flying around the atmosphere and they're missing work and other things, they're at home or at the office doing other things, and then something pops up on the screen saying, Dr. Lacaille is available for you now. They press a button, and then there the visit goes.
So any physician can join. You don't have to be a Medyo physician.
There's no such thing. Every physician is a Medyo physician. Every person in British Columbia is a Medyo user. So free to sign up for the patient, free to sign up for the user, and thankfully this is currently supported by our Ministry of Health as well as the British Columbia Medical Association, because they recognize that health technology can support these continuous relationships.
Other questions? Because we're going to do a couple of questions here that are directly related to Dr. Cadesky's talk, and then we'll have a panel discussion with all of our speakers.
have recently moved to Vancouver and have been unable to get a family doctor. I'm wondering, do walk-in doctors, and can I get the same doctor? I have sort of one that I prefer. So might that work for me?
This is a fantastic question, and obviously in 9 minutes I couldn't touch on everything. But what you're speaking to is the idea of attachment, and that's really something that's very, very dear to my heart. And in fact, we know that about 20% of people in the Lower Mainland do not have a primary care physician, and that's really the nexus of the care. That's the medical home. We know of those people. Some people don't want, but there are a number of people that do. Now, there are a number of initiatives that are going on. There's something called the Attachment Initiative, otherwise known as a GP for Me, being run through the divisions of family practice. And that's a resource that is being created as we speak in some places like South Surrey White Rock. There are already facilities set up for that. Places like Vancouver, it's coming soon. But one of the things is that when you do log on to this resource, because the idea is to set up attachment and to promote those relationships, there are 3 types of patients. One is, I'm logging on, I'm meeting Dr. Lacaille, perfect. Number 2 is, I'm logging on, I can't see my regular doctor because for whatever reason they're not available and there's no backup, in which case there will be other physicians that are available. And when you see that person, because the point of this is to encourage longitudinal continuous relationships, a copy of that visit will be sent to the regular doctor. So Dr. Lacaille is not available. Okay, here's what we're going to do today. We're talking about your rheumatoid arthritis. It sounds like there's a flare. Here are the changes we're going to make. I'm going to send a copy of everything to Dr. Lacaille so that when she shows up in the office tomorrow, everything will be there and that care will be continuous. The third thing is someone who shows up and says, I'm not lucky enough or I haven't been fortunate enough to attach myself to a family physician. And in that situation, the coordinators, when you sign in, will ask you, and if you identify yourself as someone who is not currently attached, what they will do is they will say, here are the resources that we have for you. There's the College of Family Physicians, there are the divisions of family practice in your area, and we're also going to be starting to collect our own list of doctors who have identified themselves as having practices that are open, and so we'll be able to attach you that way. So there'll be 3 ways for those unattached or orphan patients to be attached to someone so that they can continue their journey in a continuous longitudinal relationship. So excellent question. Thank you so much for bringing that up.
We have one from online.
We have a question on Twitter. How do we encourage our doctors to sign up for Medyo in BC?
Ask them. Tell them that it's free. Tell them that it's not too good to be true. And tell them to try it out like anything else. We know that most physicians are adopting electronic medical records. It took a while for that sea change to come. But again, the more that, and this is what I really love about how technology is really leveling the playing field, and we've moved from these paternalistic relationships where the doctor knew everything and came in smoking the pipe and told the pregnant woman exactly what to do, to where people are coming in with research that they've done, with information that they've gathered, asking for questions, so that at the end of the day that decision can be from you as the individual, the most important person, the healthcare team. And so the more that you're saying to your physician, you know what, I'm really having a hard time coming in. I'm having a hard time leaving work to see you. I'm having a hard time finding a babysitter so I can come in. You know what, if all we're going to be doing is discussing the results, and you're coming in to take my blood pressure, and I've had to cross 2 toll bridges and fight for parking and wait in the waiting room, and I don't even want to know what's going on in your magazines, and now you're taking my blood pressure, and that's what we're basing our decisions on, versus I've taken my blood pressure once a day for the last 2 weeks at home. Here's a list of it. Now what would you like to do? So saying to your doctors, I think that this is actually going to provide me with better, more efficient care, and I think this is going to allow you to provide me with better, more efficient care that fits more into your lifestyle as well as mine. Hey, can we try this out?
How does a doctor on Medyo get paid?
So basically what happens is most physicians in British Columbia are paid by what's called fee-for-service. So I say to the doctor says to the government, I removed an appendix, I caught a baby that a woman delivered, I diagnosed and treated a pneumonia, I provided counseling about smoking cessation. And there are codes for these things, and the government says, this is worth this much money and this is worth this much money. So currently, as of 2009-2010 fiscal year, there has been a code that supports these teleconferencing visits. And so that's something that's really important, that at the time, these technologies didn't really exist. So it's important now that now that the future has arrived very quickly, that we continue to let people know, hey, even though we didn't envision that this was going to be the case at the time, this is really working well. And so we want to continue supporting these things that are allowing people to receive this care free of charge as part of the care that they receive as part of the medical services plan, and codes that help encourage doctors to provide that care for you.
Thank you. Following along the questions of how to find a physician, I have a couple of questions. Do you know whether the ministry's HealthLink 811 telephone number refers to Medyo, and also are nurse practitioners involved?
So two excellent questions. In terms of 811, I'm not sure if you would have to ask them directly if they're aware of this service for people who are unattached, to say, well, it sounds like this is something that we can't do over the phone because you're telling me you have a rash and I can't see it over the phone. But if you're in some place where you're remote and you don't have access to a doctor readily, perhaps you could see this video teleconferencing. And because the picture quality is fantastic, I'm able to do a lot of wound care and diagnose a lot of skin conditions because that camera is so great on the smartphones and the tablets. And in terms of the second questions, yeah, there's no reason that allied healthcare professionals like nurse practitioners, like psychologists can't be part of it. In fact, there are a number of projects ongoing now to link people up with counselors and other healthcare providers so that those other services can be accessed.